Canadian families feel helpless these days, with fatty food choices on almost every corner and fresh local produce often too expensive or hard to find. This puts children all across the nation in the midst of a childhood obesity epidemic spanning 25 years, where the numbers have tripled. 26% of Canadian children ages 2 to 17 years old are currently overweight or obese.
If a child is actually born to an obese mother, there's about a 30% chance that baby's going to end up obese by the age of 4.
Much of the focus needs to be on their years beyond childhood, and what is happening is a trend amongst Canadian youth that will lead into adulthood. Approximately 1/3 of normal weight 20-year-olds will become overweight within 8 years, and approximately 1/3 of overweight 20-year-olds will become obese within 8 years. This epidemic just does not center on overweight individuals, but is an issue that can affect normal weight youth and adults. If this continues, in 20 years, we can expect a whopping 70% of the 35 to 44-year-olds in Canada to be overweight or obese versus the current 57%. People fail to realize the health risks with having an overweight child, and do not realize the long-term detriments could be life-altering and long-lasting.
Some of the more obvious things that a child can develop from prolonged obesity can be body image issues, feeling negative about oneself because you're overweight or feeling like a failure because you're not like your peers. You can also develop social anxiety, so feeling judged by others in certain situations, be it in sports or out on the beach, feeling uncomfortable with yourself. And then over a long period of time, more serious conditions can develop, such as depression or even eating disorders.
There is an alarming increase in the number of children and adolescents developing type 2 diabetes, also termed as adult onset diabetes due to being overweight.
It can actually cause an insulin resistance. So insulin is what helps to manage the sugar in our body, and if our body is resistant to the very thing that keeps our sugars down, diabetes is naturally going to develop.
The high levels of cholesterol and high blood pressure that are some of the main risk factors for development of heart diseases are found in most of these obese children.
One of the hallmarks of childhood obesity is that they do not sleep as well, and sleep apnea is often related to that.
In rare cases, this sleep apnea may lead to other problems like difficulty in learning and memory. Childhood obesity is affecting more than just a child's appearance.
Obesity can affect school development, and we know that children tend to do worse in school when they have weight issues.
At the University of Pittsburgh, a study was done comparing the brains of normal, overweight, and obese individuals. The results were staggering. Overweight people had 4% less brain tissue than people of normal weight, and obese people had 8% less brain tissue than people of normal weight. This makes the brain appear and function 16 years older than it should. But how does this play on our economy?
The direct cost of obesity was $1.8 billion. Now that's not taking into account the indirect costs of obesity, which would be time off of work, disability leave, all those other things. Once they added that into the calculation, it was actually closer to $4.3 billion. Now that was 10 years ago, and obesity has been continuing to rise over the last decade, so you can only imagine how much more it's costing our system by the day.
Childhood obesity is not going away anytime soon. Parents, their communities, and the government need to start taking a more active role in their children before it's too late.
Just looking at the types of foods you're providing your child, so limiting the amount of sugary drinks like juice or pop. The average kid shouldn't be having more than 1 cup of juice in a day.
Simple things such as introducing more fruits and vegetables in the diet and decreasing screen time by a few hours every day is a step in the right direction. The power is in our hands, and it's up to us to use it for our future generations.